Hi everyone, this is Megan Sterner and I'm a doctor of physical therapy at the La Mesa Spinezone, coming to you with another Spinezone spine segment on pain control during pregnancy. The first thing that we're going to go over is a couple stretches that will help you kind of offload your back to help to control some of that back pain during pregnancy. You're going to probably recognize these as some yoga poses as well. So the first one that we're going to do is child's pose. So what we do with child's pose is we get over here up onto all fours. You put your ankles together and you move your knees apart. And then when you're ready, you're just going to drop your hips back and then just go back as far as you can tolerate. This is going to feel really good to help get a nice stretch through your back, and it's going to kind of also let you offload your belly a little bit. If you want to get funky with it, you can reach over to one side. That's going to help you kind of elongate one side of your body, or you could do it on the other as well, like this. Hold that stretch for about 30 seconds or however long you need to kind of feel that relief. The next one is called cat-cow. What you're going to be doing here is you're going to come right back up here to this all-four position, and then you're going to gently let your belly fall down, your back arch, booty kind of pop out, and then you're going to look up. This one's called cow. Then you're going to pull your tummy up nice and tall, pull that booty underneath you, look down, and then you're going to go into cat. You can just go slowly into both of these positions about 5 times each, or again until that back kind of releases. The next one is downward dog. What you're doing here is you're folding those toes underneath you, and then when you're ready, you're going to push your hips straight up into the air, and then you're going to feel a nice stretch along the back of your legs and in that low back. This one you're going to hold for about 30 seconds again, or until your back releases, and then you can kind of get funky with things too if you want to kind of walk out a little bit. Straighten the knees, kind of do whatever it's feeling good. Another thing that's really good for pain control is trigger point release or self-trigger point release. This nifty little guy is called a Theracane. This can be found here in clinic. We sell them in clinic or on Amazon, any sporting goods store as well. This is going to really help you find your tight spots in your back and kind of help you to release them, almost like a massage. So you just kind of poke around back there until you're finding where you're looking for. With this one, you can either just poke on one spot and hold it, or you can kind of rub up and down. You can do this anywhere throughout your body, back, neck, shoulders, and then just kind of find wherever you're looking for. The next thing is kind of a cheaper option. This is using a tennis ball or a lacrosse ball to do the same thing against the wall. So we're going to come on over here. Okay, so I'm just taking this lacrosse ball. I'm going to put it in my back where I'm having that pain, and then I'm just going to lean against the wall like this. So right now, I kind of found a nice little spot that is kind of telling me to just hold it right there. So I can either hold it like that, or I can kind of dance along the wall a little bit until I kind of find that spot that I'm looking for, and that's kind of what my body's telling me to do. This one, you just kind of rub for about 2 minutes wherever you need to. You can't ever push on a muscle too much either. You're not going to do any damage. So just push as much as you can tolerate, but if you do push too much, too long, then you're not going to be able to do it again the next day. All of these pain control techniques for pregnancy that we just went over are very good for pregnancy, but can also be applied to just general low back pain as well. So I hope this was helpful, and stay tuned for more segments.